So you found yourself in the market for and needing to obtain health insurance on your own, maybe for just yourself or your family. But regardless, you are unsure of where to look and what your options even are. Well, if this is you, you've come to the right place. My name is Colin Wattenville and I run a health insurance agency called Modern Health Solutions, and I personally helped over 1,000 individuals, families, and small businesses get the right solution for their healthcare coverage. And if you are watching this video, that probably means that you might need our help. You might need my help looking into some healthcare coverage and getting some health insurance for yourself or your family for a couple of reasons. You probably don't qualify for any of the government health insurance programs. Your income's probably too high for Medicaid. You are probably not old enough or don't have any sort of disease or disability that would qualify you for Medicare. And you probably don't have any coverage through the military benefits, Veterans Affairs coverage. And if you don't have those options and you're still watching this video, then you probably also either don't have coverage offered to you through your employer, or if you do have coverage offered to you through a job or a spouse's job, then it's just simply too unaffordable and you are looking to see what alternatives there are instead of going on to that employer plan. So when you are shopping for healthcare coverage on your own, first off, hopefully you're not doing it on your own. Hopefully you're working with a licensed agent or broker like myself or one of my team members at Modern Health Solutions. But if you are, you have basically 4 options to choose from. The first option is the Affordable Care Act, also called Obamacare still, sometimes marketplace insurance plans. And depending on where you live, they can also just be a state-based exchange. So that's your first option, is the marketplace. Option number 2 are products called short-term medical plans, and despite their name, they are not necessarily just for a short-term period of time, and they can sometimes be a long-term solution, and we'll touch on that here in just a moment. But then you have option number 3, which is fixed indemnity health insurance, and that is another option through the private market, so not the marketplace. So it's going to be through a private insurance company, much like a short-term medical plan does, and there are a variety of different plan options with fixed indemnity plans. And then fourth, lastly, you have what's called health sharing programs, which are not technically insurance, but they operate and act like insurance, but it's basically a group of people that come together to help pay for each other's medical bills. So we're going to touch on all 4 of those here in today's video. So your first option, the health insurance marketplace, Obamacare, Affordable Care Act plans, whatever you call it, that's going to be the first place that myself as an agent and pretty much any other good agent or broker will look into for a couple reasons. One, the marketplace actually has tax credits, government subsidies that come into play based off of your income, household size, age, things like that, and you can actually receive assistance to lower the price, lower your monthly premium on marketplace plans. So of course, if you have some tax dollars that are available that can help lower your costs for health insurance, you obviously want to explore that option first and foremost to drop the price. But then in addition to price, because price isn't everything, the health insurance marketplace plans, the exchange plans, they're going to have the best coverage that's available. Full stop, no questions, hands down. They are governed by the Affordable Care Act law, and so by definition, they have to cover basically the most amount of services. All the preventive care is going to be covered at 100% day 1 before any deductible is reached. There are things like pregnancy and mental health, substance abuse disorders, some things that are mandated under law through the Affordable Care Act that the other options we're going to talk about might not necessarily cover at all or have some limitations and exclusions that go along with them. So the marketplace has the potential to have the lowest cost if your income and household status falls in a certain range. And then of course, as I mentioned, the marketplace has the best coverage by definition, by law, out of any of the 4 options that we're going to talk about. Next, we're going to look into short-term medical plans. Now, these products are probably the ones that get the most hate or are most misunderstood out of anything that we're going to talk about here today. And first of all, it's important to note that they're always changing. There's always government legislation, depending on which side is in control of the House, if you will, the Senate. there are a push-pull in terms of the duration of how long these plans are available to consumers. Sometimes it's been as little as only 3 months at a time, whereas some legislators like to make these available to the public for up to 3 years at a time. So that's what I meant when I said earlier that despite the name short-term medical plan, it can, depending on who's in charge, sometimes be a true long-term solution and alternative to a marketplace plan that we just talked about. Short-term medical plans are plans through the private market, so they are not necessarily regulated by the government, and because of that, they don't have to follow all of the rules and coverage laws for the Affordable Care Act plans. So first and foremost, the biggest thing I always tell prospects and clients who are looking into or have one of these plans, if you're on a short-term medical plan, they do not cover your pre-existing conditions, definitely for at least the first year, sometimes for the life of the policy. So if you have any pre-existing conditions that are very serious, then it's probably not an option for you. You would most likely want to go to the marketplace. But for those who are fairly healthy, on the healthier side, maybe just 1 or 2 maintenance medications, these plans are great and very much a viable option for people. They also often will have broader networks available, nationwide PPOs, whereas a lot of plans, most of the plans through the marketplace, in option number 1 that we just talked about, are going to be narrow networks like HMOs or EPOs. But for those people who don't get a subsidy, don't get tax credits to help reduce the cost of a marketplace plan from option 1, short-term medical plans are a great alternative if you can qualify health-wise, and as long as you're okay with some of the limitations. You know, these plans probably won't cover pregnancy, they probably won't cover pre-existing conditions. Like I said, they'll have annual lifetime maximums, so maybe they'll only ever pay up to $1 million in claims if you get sick. There are certain random exclusions that come into play. You know, one disease that always comes to mind for some reason is excessive sweating. Hyperhidrosis isn't covered under a couple of the major short-term medical plan carriers, at least in my areas that we market in and help clients in. So there'll be some random exclusions out there. Mental health isn't always necessarily covered the best. The preventive care usually has an annual maximum allowance, so on and so forth. So again, if you do find yourself healthy and aren't necessarily worried about a lot of those things, then the cost for a short-term medical plan will be a lot less than the full price of a marketplace plan. And that's why they're so attractive to a lot of people. So next we'll look into what fixed indemnity insurance plans are. These plans are kind of complicated, and so I actually made an entire video already going over these plans and describing them in a lot more detail. But for the sake of this video and summary, just know that fixed indemnity health insurance plans kind of work the opposite as a traditional health insurance plan, where instead of having to hit a deductible before you have coverage and then having a max out of pocket, fixed indemnity plans will have first dollar coverage, first day coverage. So it says a specified amount that the plan will pay per service. So for example, a fixed indemnity plan might pay $500 for an MRI, but then of course if that MRI costs you $3,000, you're on the hook for the difference. With a fixed indemnity plan, it clearly lays out how much the insurance company pays you, so then you can pay the hospital or doctor for each and every service that you might come across for a health insurance plan, for healthcare. So these plans have a lot higher utilization because you don't have to spend $4,000, $5,000, $6,000, $7,000 on a deductible before the insurance plan will pay out. They pay out immediately without having to hit a deductible amount. But on the downside, there is no max out of pocket. So if you have a fixed indemnity plan that pays $1,000 per night in the hospital, but the hospital is charging you $2,000 per night you spend there, then obviously you're on the hook for that remaining $1,000 difference with no cap. There is no max out of pocket on a fixed indemnity plan. It's just, here's how much we're going to pay for different healthcare services, and the rest is on you. It's also worth noting really quick that fixed indemnity plans, they could also have some of the exclusions that short-term medical plans do. They might have a waiting period for pre-existing conditions. They might refuse to cover, mental health counseling whatsoever. They might not include any coverage for pregnancy. So you want to really look at these policies carefully because they vary wildly. And again, much like short-term medical plans, fixed indemnity plans don't have to have all of the coverage mandated under the Affordable Care Act marketplace laws. Lastly, if you're shopping for health insurance on your own or through a broker, then your fourth option is to look into what's called a health sharing program or health share program. They go by a couple different names, and front and center, these are not health insurance plans. They are not regulated by the Affordable Care Act law or even really the Department of Insurance for a lot of states. So they're kind of the wild, wild west, and they have a myriad of different rules that go along with them. The way they are even able to exist and circumvent the insurance side of things is they don't use insurance language, so they won't use words like deductibles, copay, co-insurance, max out of pocket. They'll have their own verbiage depending on what company you're obtaining these through. They also a lot of times are affiliated with religion for some reason. That's probably a way they get around the laws and have that loophole, where a lot of times you'll have to attest that you're a Christian or a different faith or religion, and sometimes I've even heard of customers having to get their pastor to sign off stating that they are a member of that specific denomination or even facility of place of worship. So they're really weird, very interesting. Again, they're not insurance plans, but they do cover healthcare costs for people. Some of them kind of operate like a insurance plan where you have an ID card, give it to the provider, they submit the claim on the back end, they have networks. There's a similar quote unquote max out of pocket. It might be called your annual household share or something like that. So be on the lookout for these. They're becoming more and more popular as people seek alternatives to those other three options we talked about. But again, I can't really speak too much on these because they're not insurance. We do offer a couple of them. Some of them do work with brokers, but each and every one is so different. They vary so wildly and have different rules and different exclusions that really, to shop for a share program, a health sharing program, best, you need to look at each individually and kind of throw everything out the window once you look at one and you move on to the next one, because they may have totally different rules and coverages. And there you have it. Those are the four main types of products that you can look into when you're looking for health insurance or healthcare coverage on your own. Again, as a reminder, we have the Affordable Care Act marketplace plans, short-term medical plans, fixed indemnity health insurance plans, and share programs. And a quick recap of each. Affordable Care Act marketplace plans going to have the best coverage available out of any of the options and the potential for lowest cost if you qualify for tax credits and government subsidies. Short-term medical plans, those are going to be an option to the private market. They generally have bigger and broader networks, but they do have a lot of exclusions that you have to watch out for, most notably pre-existing conditions in pregnancy. But if you don't get a subsidy from the marketplace, these plans can be a lot cheaper than going with a exchange Affordable Care Act plan. Then we have fixed indemnity health insurance plans. Fixed indemnity plans, those are the ones, again, that are first dollar coverage, so there's no deductible to hit. They pay what they pay. They might pay $50 for an x-ray, and if an x-ray costs you $75, then you're on the hook for the difference. And they might pay only up to 15 grand for a surgery, but if your surgery costs 40 grand, you're paying the difference with no out-of-pocket maximum. So because of that, they're actually probably even cheaper than short-term medical plans, which again are often cheaper than marketplace plans without a subsidy. So fixed indemnity plans are probably going to be the cheapest of these options that we're talking about in this video. And then fourth, lastly, health sharing programs, Christian share programs, sometimes if it's religious affiliated. Again, recap with those. They're not insurance. They vary wildly. Please proceed with caution. So there you have it. If you find yourself in the market for health insurance and needing some healthcare coverage for yourself and or your family, those are your main options, and we would love to help you out. If you do need some assistance, you can reach out to us. All of our contact information is below. Again, my name is Colin Wattenville. I own Modern Health Solutions. Myself and the team of agents are on standby to help you find the best coverage for your situation. And if you enjoyed content like this, then please hit the like button to help out the channel. Make sure you subscribe to stay up to date on our latest videos. Leave your thoughts and comments down below, share it with a friend or family member, or even just follow us on your favorite social media platform. Thank you so much for watching, and until next time.